It's time for another Achilles tendon video.
The hits just keep on coming.
We've made a few, but this injury is so common and becoming more and more common, thank you, pickleball,
Yeah, no kidding.
that we thought it was necessary to make another one.
Okay, so we're talking about non-operative treatment of Achilles tendon ruptures.
He's Brad Weaning, I'm Paul Zalzal, we're talking with docs.
Welcome.
So the main impetus for me to want to make this video is because I've seen a number of patients present with an Achilles tendon rupture, but inadequate initial treatment.
Okay, so they're presenting a little bit later, and they were not protected while waiting to see you.
Yeah, and that's really important because, as we've talked about before, there's two ways to treat Achilles tendon ruptures.
Okay.
Surgically and non-surgically.
Okay.
If you don't get appropriate initial treatment, then you're giving away the non-surgical option and committing to the surgical option.
Okay, fair.
Fair?
So when you rupture your Achilles, it's going to feel maybe like someone kicked you in the back of the leg, stabbed you, cut you with a knife.
Heard a pop, thought the ball hit me in the back of the leg.
And then you have a difficulty walking and the inability to push off. So imagine you're pushing a gas pedal, you can't really do that.
Can't do it.
Because your calf muscle is no longer attached to your heel by that tendon that makes up your Achilles tendon.
That's it. So you can't do that.
Okay.
And if that goes on and it's not treated appropriately, you will never be able to do that efficiently, and that will interfere significantly with your gait or your ability to walk or how you walk.
We most commonly see this in the 46-year-old soccer, basketball, volleyball, pickleball now. Whole mama pickleball, look out. I know lots of people.
Yeah. So
you should go to the doctor.
Definitely.
Ideally, a walk-in clinic or the ER. You probably should not even wait to see your family doctor, to be very honest with you.
No, yeah, you don't want to walk this one off.
What are they going to do?
The most important initial treatment is to immobilize your leg with your toe pointed down.
Plantar flexion.
You want to, I say do it like a ballerina or a, wait, what's a male ballerina called?
I don't know.
Ballerino?
Sure, ballerino.
Ballerine bro?
Ballabro.
Balbro.
We just coined
Even
it.
ballerina. Is there, leave a comment if you know what the male term for ballerina is. But you want to be like a ballerina or ballerino with your toe pointed down as much as possible.
Right,
Okay.
and this is early, and so you shouldn't walk on it. You should get immobile either in a splint or some type of protective, and not a boot that has you at 90 degrees, which is part of your treatment.
Yes.
But you need to have those toes down for the first couple of weeks.
Yes. If you do get put into a boot, okay, you want to make sure that there's a heel lift in the boot. Okay, so like high heels inside the boot. It's got to be at least 2 centimeters, preferably a bit more.
So it doesn't look like this, your toes down. So you want your toes down to take that pressure off the Achilles and actually bring the ends of the ruptured Achilles together. Yes. That's why we put the toes down.
That's a good point. The reason we want your toe down is because your Achilles tendon ruptured. Point your toes, it brings the ends together again.
2 other quick things. This is primarily a clinical diagnosis. Squeeze the calf, nothing happens, that's one test. You can often feel the gap. You do not necessarily need an ultrasound or an MRI unless you're unsure of the diagnosis.
Yeah, I wouldn't delay treatment to wait for an ultrasound or an MRI. If you suspect an Achilles tendon rupture, immobilize your leg with your toe pointed down.
Right. The other thing I'd say, discuss with your doctor, but consider some type of anticoagulation while you're not walking. That's just a little side note of any lower extremity injury.
Yes.
So now,
especially if you have a risk of DVT.
100%. So now you're at the time where you're seeing the surgeon. You say it happened just a couple of days ago. So there's the operative and the non-operative side. We have a whole video about operative treatment, which is a good treatment. We're going to talk about non-operative treatment right now.
Yeah.
So what do you do for the first couple of weeks?
For the first couple of weeks, I'm going to continue immobilizing the leg with the toe pointed down, and I do that with, usually I do that with a heel lift inside a boot, and the heel lift is at least 2 centimeters high. Oh, and don't use a heel lift that's made out of sponge, okay? So if the Emerge doc or a walk-in clinic, whoever says, yeah, here's a heel lift, and it's made out of sponge and you can squish it, it's not doing its job. It has to be a rigid heel lift that doesn't compress.
That sounds like the non-heel lift.
It's just that's more like a insole.
Sometimes that's why, sometimes I'll do a cast for the first couple of weeks.
Yeah, some people do put a splint on or a cast on.
And there's a whole bunch of protocols that have been developed over the last kind of 15 years, I would say, that have really swung the pendulum to make non-operative treatment a successful form of treatment. Because before we used to operate on all of them 20 years ago.
And all these protocols have in common a period of immobilization with the toe pointed down, either with a hinged brace or with heel lifts inside a boot. Then eventually around the 6-week mark, that heel lift is taken away and you're starting to bring the ankle up gradually, still with some immobilization, and then we go to a period of mobilization where you get your range of motion back, and then we go to a period of strengthening.
Yeah,
and all the protocols.
And I would say the biggest change is that Early on, we let you weight bear, so that's different from the old non-op treatment. And then I would say as you reduce that wedge, whether it's weekly or every 2 weeks, that slowly starts to bring you up, and you also get into physiotherapy early. So you start doing gentle range of motion, you don't do resisted plantar flexion, you don't do aggressive passive dorsiflexion, which will stretch and potentially rupture the Achilles as it's trying to heal. So it's a very specific protocol that your therapist will have access to that increases your range, gets you walking earlier, and then slowly, like you said, fully weight bearing, potentially out of the boot around a couple of months, and then depending on the protocol and how you're doing clinically, and then back to normal activity in sports. It's long though, even 4 to 6 months, even up to 1 year, but comparable functional outcomes.
Is this the kind of thing that you're going to heal from in 6 weeks?
No.
This is a long haul. This is going to take upwards of a year to recover.
I tell patients that have this in the clinic, because usually it's like a 45-year-old person. I'm like, you are going to be tired. I see them like every 2 weeks. They're like, you're going to be so tired of seeing me.
Yes.
And you just want to get going. They feel good because thankfully, it's not a particularly painful injury, and they just want to get going, and they have jobs, and they have kids, and they have lives, and they're annoyed by this injury because they want to get back to pickleball.
Yeah, right. That's it. But it's a long haul.
Yeah, so biggest difference, I'd say, non-operative treatment, you avoid the risk of surgery, which are, I'd say, less than they used to be, but they are still measurable.
Oh, definitely. And one of the big risks there is infection, because that Achilles tendon is so subcutaneous. Yeah. There's not a lot of between the outside world and the Achilles tendon, just a thin layer of skin and some subcutaneous
The surgeries
tissue.
are smaller than they used to be and a lot thicker. And I'd say the biggest difference is that I'd say non-operative has slightly higher risk of re-rupture, which is what we worry about, whether it's surgical or not surgical. There is potential to re-rupture. It is slightly higher in the non-operative.
There you go.
Yeah. Now you know. Leave a comment if you have a ruptured Achilles tendon. If you know someone, they had surgery, didn't have surgery, let us know what you think.
Yeah, let us know how long it took you to recover. Remember, you're in charge of your own health.
And if you like this video, please like it, subscribe to our channel. We'll see you next time.
Hey Brad, do you know how many subscribers we have on YouTube now?
1 million?
That's right, that's why we're wearing these glasses. If you're a subscriber, thank you very much. If you're not, help us to get to 1,000,001. Thanks to my brother-in-law Ben, who made these glasses for us.
Oh, no way.
Yeah, on his 3D printer. And if you know where we just stole that script from and the idea to wear these glasses, leave a comment. There's a very common clip you see on YouTube.